Welcome to the Illinois Lyme Virtual Education and Support Meeting. Illinois Lyme Association is a nonprofit organization. Our goal with these meetings is to bring education to you. Lyme disease is very expensive. We are not medical doctors, but we do have a doctor that is on with us tonight. And the purpose of this meeting is for education. So please take any information that you might gain from this meeting and take it back to your own provider. And okay, so before we get started, I just want to make sure everybody has a glass of water right next to your computer. Drinking water is super important to support our detox organs and to help us meet our water goals for the day. And also, I want to say that the ticks are out. My husband did come home yesterday from golfing with 2 ticks on his white hat. Thankfully, he had white on. That was great. We removed them, put his clothes in the dryer, but the ticks are definitely out. I've seen quite a few people. So this is like a very timely presentation that we have here with our guest speaker today, Dr. Alexis Chesney. And the title of her presentation is Preventing Lyme and Tick-Borne Diseases. So she has a very impressive resume, and I'm just going to read you her bio real quick. Dr. Alexis Chesney is a naturopathic physician, acupuncturist, author, and educator specializing in Lyme and tick-borne diseases. Dr. Chesney enjoys getting to the root cause of complex chronic illness and partnering with patients to find wellness and balance in their lives. She has a telehealth private practice and consulting business and also practices telehealth at Sojourn's Community Health Clinic in Vermont. She's a member of the AANP, Vermont Association of Naturopathic Physicians, the International Lyme and Associated Diseases Society, ILADS, and a founding full member of the International Society for Environmentally Acquired Illness. Dr. Chesney served on the board of directors and is currently the Naturopathic Medicine Committee Chair for ILADS. So she's also an author of the book called Preventing Lyme and Other Tick-Borne Diseases and speaks across the nation. And I have to say that this is her book. You can tell I have gone through it from front to back. It is well worth the time investing in this book and reading through it. She has lots of great tips. And we are just so excited to have her. And this is just a great time of year to have her and her knowledge. And so I'd just like to welcome Dr. Alexis Chesney.
Thank you so much, Terry. Thank you for having me. It was so great to meet you in the fall and hear all about this organization and the amazing work you're doing here. And Lynn, thank you as well, and good to meet you today. So I'm really glad to be here to be able to educate on prevention. I've been practicing since 2010, seeing people with Lyme and tick-borne diseases, and what got me really passionate about this subject is, unfortunately, sometimes I would see people come back to see me after getting well, and they'd have a new tick bite. And I'd say, oh my goodness, we need to stop getting tick bites. So I had this handout that just got longer and longer, and I'd hand it to all my patients and we'd talk about different ideas. And so that became the book, and now there's an online course. So if you're interested in any of those things, there's lots of information. It's hard for me to condense things, but I did my best for today. So it's just a taste of other information that's out there. And I'm sure a lot of you already know a lot of this, but I hope I can bring a little bit more information to equip you, especially during this tick season, so-called, right, tick season that's upon us right now. So, all right, so let's get started. So there we go. So without an effective vaccine or accurate testing or a simple effective treatment, I think we all must do our part to educate ourselves and each other in order to stop this Lyme disease epidemic. So one of the naturopathic principles is prevention is the best cure. And so I really take that to heart here. So in preparing today, I wanted to look up some information about Illinois. And actually, I was really happy to see that, and it sounds like more recently there's been quite a movement to get a little more tick surveillance done out there in your state. So that's great to see. And so I was able to pull some of that information as well. So let's talk about ticks. So they're arachnids. As you may know, they're actually not insects, but arachnids, like spiders. The hard ticks is mostly, that's who we're going to be talking about today, the exodids. They have this dorsal shield, while soft-bodied ticks do not. And so we'll talk about that because of tick identification, which I think is important to be able to identify ticks. So then you can find out, well, what kind of tick is it and what might it be carrying? What diseases do I have to look out for? Ticks are parasites, so they depend on a host's blood for nutrition, like our dog or a little mouse or ourselves, hopefully not. And then they're the vector, which is an organism that transmits a pathogen from a reservoir to a host. So getting, transmitting Lyme to you, or hopefully not you, but somebody else. So here we're going to talk about North American ticks. Now underlined are the ticks that we're going to talk about today. So just the format for tonight, we're going to talk about ticks. We're going to focus in on just talking about Lyme disease regarding all of the pathogens. I just needed to choose one to focus on today, but we'll cover at least knowing about all the pathogens that these ticks can carry in your area. And then we'll talk about tick control and tick bite prevention. And then we'll talk about what to do if you get a tick bite, and then acute tick-borne diseases, which we'll just focus on because of time on Lyme disease. And hopefully we'll get through that quickly, and we'll get to your questions. So here we have underlined, we'll talk about the black-legged tick, which is the notorious tick carrying Lyme and other tick-borne diseases, the American dog tick, Lone Star tick, brown dog tick, and Gulf Coast tick that has made its way to Illinois. So here's our public enemy number one, the black-legged tick, or the deer tick, as you may call it. So of course, we'll focus on this tick for a lot of what we're talking about today. So this is the Ixodes scapularis. So it might carry Borrelia burgdorferi, and sort of near your area, I wonder. I have not read anything about Illinois, but Borrelia mayeni in the north central states can also transmit Lyme disease, and that's carried by this black-legged tick sometimes. Borrelia miyamotoi, which causes tick-borne relapsing fever, Babesia species, Anaplasma ehrlichiomuris, which can also be in ticks in the north central states, and then Powassan virus. So here we have a nice map that they created there at the Department of Health in Illinois. So we see where the black-legged ticks have become established. So quite a lot of the state is definitely covered. So let's talk about these different life stages of ticks. So we have a nymph on the left-hand side. That's the second stage. So that is actually the size of a poppy seed. And then on the right side is our adult black-legged tick, a female. And you can tell that because of that tannish reddish abdomen color. And that is the size of an apple seed. So here's another lovely picture. So here's our engorged tick compared to a non-engorged tick. And what we're going to be talking about next is identifying that dorsal shield. So I want you to take a look at the mouth parts of these ticks and how there is a solid black circle right after that, and how with the one that is engorged, you can still see that solid round black color. That's the dorsal shield. So that makes us identify this as a black-legged tick. The whole belly there, the abdomen, is now bloated. So a tick will attach to a host and feed from 3 to 5 days and get much larger and fall off, and then just lay there and digest for a while. So you can see how that reddish tan part that some people use to identify a tick changes, right, when it starts feeding and starts enlarging. You no longer have that nice little reddish tan flag. Because some people talk about size of ticks. They say, oh, it was a big tick. It must have been a dog tick. And actually they bring it in and I see it and it looks like that. And that's actually a black-legged tick that was engorged because it had a blood meal from somebody, which is even more concerning. So just a note on that. And then we have that egg mass down there. Unfortunately, after that adult female has the last blood meal, it will lay this egg mass. So let's talk about the cycle. It's a 2-year cycle. So there's definitely overlap in this life stage that we see out there in nature. But this is like one pattern that we'll go through, right? So we have the eggs, they hatch out to larvae. Now these are the size of a period at the end of a sentence, very, very small. They're going to stay close to the ground. Ticks need humidity to survive. They need moisture. So they're not going to go very far. They're smaller. They don't have a lot of energy to crawl up a piece of grass yet. So they're going to attach to somebody who's very small and close to the ground, like a mouse. That's 75 to 95% of larvae first attach to a mouse. And that's where they actually get Borrelia burgdorferi, or the cause of Lyme disease. So we'll come back to how that's important later. So they have their first blood meal and then they grow an extra pair of legs. They become nymphs and then they might winter over. It takes -20 degrees Fahrenheit to kill ticks. So more and more we're seeing them survive the winter up north, right? So they may not be active, but they may be under that snow cover just waiting to pop out in the spring or even during the winter when it's warm. So once it's 28 degrees Fahrenheit, they are active, or they can be. They like it when it's they like it more when it's even warmer, but they can be active when it's even 28 degrees. So we have our nymphs. Now they're going to look for another blood meal. They might go a little farther. They might find your dog or maybe a mouse or even you. And then they will have their next blood meal, the females. And the females will then become adults and they will need another blood meal again. And again, they may have a deer is often common for that next blood meal or someone else until they lay eggs. So we have that 2-year life cycle. And so that lends to this seasonal activity of these 3 stages of the black-legged tick. And so we have these bookends. So right now you're probably seeing the adult black-legged ticks out there. And so we'll see them in the spring and then again in the fall. From June and July, we'll see the nymphs, which are the size of a poppy seed. So we have to keep our eyes peeled a little bit more during those months. And then in August and September, I often hear how, there are no ticks out. Wow, they must be gone. Ah, it's been great. And, to some degree, that's slightly true because we don't see as many because there are so many larvae out there and it's unusual for them to attach to humans, but they can, it happens for sure. And there are also some adults and nymphs out there. So it's important to still stay vigilant at that time. But it's true, we'll see less activity and then they'll pop out again in October. So I often hear about how, oh, the ticks are back, we're surprised and we forgot to do our permethrin treatment of our shoes and whatever else we'll talk about tonight. So please be aware of this pattern. I can kind of help you out a little bit more. Okay, so talking about our next tick, the American dog tick, and we'll compare this tick to the black-legged tick. This tick can carry Rickettsia rickettsii, which can cause Rocky Mountain spotted fever, and Francisella tularensis, which causes tularemia. Now, actually, we don't see a lot of pathogens carried in the American dog tick in Illinois, which was nice to find. So it doesn't mean it couldn't happen, but we have less of a risk for tick-borne disease with American dog ticks actually in Vermont and New Hampshire too. It's extremely, extremely rare. So here's our map of Illinois where the American dog ticks are. And then let's talk about tick identification. So I talked about that dorsal shield. So I want you to know about this because although they're so tiny, I mean, look at those. I know the arrow's in the wrong place there, but the top one and the bottom, they're both black-legged nymphs, those little dots on that person's palm. I mean, they're so small, but if you're able to get a magnifying glass and take a look, you might be able to identify that. And of course, we'll talk about tick testing. You can send it out and have them identify it and the pathogens they're carrying. But if you get a trained eye, you can do this yourself. And just looking at that Ixodes scapularis, which is the deer tick on the left, compared to the American dog tick on the right, they look very different. So you really need to look at the dorsal shield and that solid black versus that mottled brownish, whitish. They are different. And when they're engorged, that is the only part that will look different. So that's the way to identify a tick. All right, now we have got the Lone Star tick. So you do have this in your area as well. And they can carry Ehrlichia, Francisella, which causes tularemia, Heartland virus, Bourbon virus, the unidentified pathogen that causes star eye, which is a Lyme-like illness, and there's a lot of discussion about that, whether that's a Borrelia. It's been called Borrelia lone stari, but even still, there's a lot of discussion amongst scientists about this. And so I'm very curious about that, but for today, we'll leave that there. Also alpha-gal, I don't know if you're seeing a lot of alpha-gal in your area. So this is the sugar that can cause this syndrome. People can have an allergic reaction to the alpha-gal sugar that's carried in the tick saliva. Not everybody will have that reaction, but some people do. So it's not a pathogen, it's not a bacteria, but it is a disease or a syndrome caused by the tick saliva in the Lone Star tick. So here are Lone Star ticks in Illinois, some more southern. And now we have the brown dog tick. So these are all over the country. And really, they usually don't bother humans, but it's worth mentioning because they are in Illinois. So they can carry Rickettsia rickettsii, which causes Rocky Mountain spotted fever. Really, we just see these with dogs, like kennels or places where dogs are kept for breeding, etc., and indoor. So we don't see indoor infestations of ticks except with the brown dog tick. So that's something to be aware of. May or may not be relevant to your life, but then a human could get inadvertently bitten, and that's where some Rocky Mountain spotted fever can come from. And then the other, because you definitely have Rocky Mountain spotted fever in Illinois, the other culprit for that would be the Gulf Coast tick. So it carries Rickettsia parkeri, different species, but very, very similar, basically same symptoms as Rocky Mountain spotted fever. And this tick can also carry Ehrlichia. So that's also in your area. And this is actually updated because my range maps are from my book, which was published in 2020. And I did a lot of digging beyond those, you'll see those CDC maps. And I was adding additional research that I had found. But even still, we've got an updated map now. So we have some Gulf Coast ticks, especially in Southern Illinois. All right, and what about tick attachment times? So this is a big question out there, right? Someone might go to urgent care with a tick bite and say, well, how long was the tick on? Well, I don't know if you need to take any treatment, right? And I hear all sorts of things. It'll be 24 hours, it'll be 48 hours, 36 hours. It seems like every patient report back that I get is different if they've gone to the ER. So here's a nice list of the most updated this year research on this. So of relevance are the arrows for your state. So you can take a look at that. Anaplasma 12 hours is the minimum recorded tick attachment time. That's what I think is the most important thing to think about, right? How quick can this be transmitted? And so Lyme, there is a study showing it can happen in as little time as 4 hours. Now, most of the time, there are studies showing that it's probably going to take at least 12 hours, but there's a bit of a bell curve there. So thinking about the likelihood of tick-borne disease transmission, definitely increases the longer the tick is attached. But as we'll see in the next slide, some of these ticks there are have already partially fed. So about 10% of ticks that are questing, which are like reaching, looking for a host, have actually fed on a host already, but were interrupted. So they're kind of primed like that. The bacteria may be in their saliva already, and it may not take as long for them to transmit these diseases once they attach to another host. So this whole idea of, how long was the tick attached for, I don't get very attached to that idea. And I'm looking at, other information and decision making around treatment. And what do we want to highlight here? I think, there was, well, I guess there's Powassan. I didn't put an arrow next to it, but anyway, you do have Powassan out there, and that only takes 15 minutes to be transmitted. Luckily, it's a rare disease, that is true. But how quickly that can be transmitted by a black-legged tick, I think that's of note. So here we have our information about these partially fed ticks. So within 24 hours, 83 to 100% of the partially fed ticks out there have transmitted Borrelia to mice. So this is a mouse study. And then within 48 hours, 100% have transmitted Borrelia burgdorferi, the cause of Lyme. So yeah, I think this is just important to note and for physicians out there to know about. All right, so we're going to talk a little bit about, for today, I think we're going to just focus on Lyme disease, but just to review that, you're probably all experts in this, but we'll go through some information. Here's Illinois. I love their graphs. Guys have some nice graphs. So I just was curious, which diseases are you dealing with? So number one looks like Lyme disease. And of course, we know this is just a drop in the bucket of what's really going on, but at least there's some surveillance and it's good to have this information. But you have anaplasmosis, babesiosis, ehrlichiosis, Lyme, and Rocky Mountain. So a little background, which again, I think you're all probably very educated on this, but we'll go through the beginnings of Lyme. So of course, that was out in Connecticut, named after Lyme, Connecticut, when Dr. Alan Steer was seeing a lot of kids with what he thought was juvenile arthritis and realized, actually, this is an infectious disease. And across the Sound on Long Island, New York, Willy Burgdorfer discovered the bacteria in these ticks on Long Island, named after him, Borrelia burgdorferi. So even going back 5,000 years, we know Borrelia has been around a long time. They found it in that Iceman. So it's been here a long time, and we'll see how it can shapeshift and hide in the body, unfortunately making sometimes treatment hard. So with Lyme, the symptom onset after a tick bite is 3 to 30 days. So always looking over the next 30 days at least for symptoms acutely, right? Today we're talking a lot about acute illness. So I'm sure there are a lot of people here who have experienced or know a lot about chronic illness, and that's mostly whom I work with as well. But acute illness can be a little different, and that's also very important, I think, to talk about. So that's kind of how this is framed today, just so you know. So here we have our map in 2022 for the United States. And then, of course, we know, and the CDC admits that really these figures only represent 10% of the cases. So in 2019, it was about 35,000 Lyme disease cases were reported, which means 350,000 new cases occurred at least in 2019. And then we have the study about some health insurance claims that were looked at, showing actually it looks like 476,000 patients were diagnosed and treated annually from 2010 to 2018. And then we just got the numbers in not that long ago, actually, for 2022. So it looks like about 62,551 Lyme cases were reported. And this is quite an increase compared to the 2017 to 2019 average. So, there were some changes in the surveillance criteria, which I think is really a good thing. They added Borrelia mayeri in there as a cause of Lyme disease, which we've known for a very long time. So, you know, maybe this means actually there's something like 620,000 cases a year, right? If we apply that information from before, and they're just getting a little closer. And the incidence actually, we're seeing, just to note, people above 65 years old, that incidence, those cases doubled for that demographic. So here's the incidence rate of Lyme by county in Illinois. So really spread throughout. Looks like more in the north, but quite a lot of Illinois is affected. So we'll talk about signs and symptoms now of Lyme disease. The erythema migrans, this perfect bullseye rash, right? That's what it always looks like. No, not really. If I see this, I feel actually like this is a blessing to have seen it, because then we get treatment right away. And it's very encouraging that when we can catch Lyme early, I truly do see people respond very well. And we still need to treat long enough, but they respond well, they get better, and they can put it behind them. So making sure not to get Lyme again, or if you do, catching it and getting early treatment is so important. So of course, the bullseye rash unfortunately happens less than half the time, but it's important to look out for. It doesn't always look like this. We'll see other pictures, but the diagnostic is that it's greater than 2 inches in diameter. So I always recommend that people take pictures of it, draw a circle around the diameter, whatever you see, because as it sounds, migrates over time, it'll spread out over your body. And if you're trying to check in on that, just a nice mark around the border can be really useful. And so it can look these different ways. So we can have diffuse borders. You know, that picture to the right, it's really hard to see that discrete border there, all the way on the outside of the breast there into the abdomen. This blister, and then a disseminated rash, which those do look more like target lesions, and they can be all over the body. I've seen that many times actually. And it's also very attention getting, so it's helpful in that way, but it can be mistaken. All of these rashes, unfortunately, can be mistaken for other things. So it's very important to mention this to hopefully a Lyme literate doctor. So here we have more pictures. So just thinking about this person with the shoulder, you know, on the back of the shoulder, you may not, you know, often these rashes are not itchy or irritating. You know, this person may have never noticed this. So please, you know, check tick bites for the next 30 days after the bite, because that's when the rash could come, and that could be the only sign of Lyme, and that, you know, we want to catch that if it's there anyway. And then on a darker skinned individual, pretty hard to see this rash on that back of knee. And so that's also really important to educate your patients or know and educate each other that Black patients have 5 times the odds of disseminated diseases, meaning they might miss that erythema migrans, that Lyme rash. So we're seeing more disseminated, meaning later illnesses, like when it's joint pains and joint swelling or neurological illness in this group of people. And early treatment is so important. So that's why I think that's important to note. So we've talked about the rash, other symptoms, flu-like symptoms, fever, chills, sweats, fatigue, headaches, swollen lymph glands, muscle pain, joint pain, of course, joint swelling. And then we can get heart symptoms, right? With chest pain, something like AV block, carditis. We can get eye symptoms and also neurological symptoms. So early on, we can have Bell's palsy, which is that facial nerve palsy, where it's usually one-sided and you'll lose control. A lot of time, my patients would say one of the first signs was like they were drinking some water and it was dribbling down the side. So, you know, you can see that usually that asymmetry in the face, although it can happen on both sides. That's usually early on. In the first month. Some of these other symptoms might not be in the first month neurologically, but they can, of course, happen early on as well. All right, so now we'll get into the tick control and tick prevention. That's the main topic of the night. So let's just talk about tick habitat a little bit, because I think this sets the stage to think about, okay, well, where do they live and how do we address that? So like I said, they can be active above 28 degrees Fahrenheit, but they like it even better above 45. And with at least 85% humidity is when they're most active. So they like to be in places where there's transition, like between, say, a lawn going into the woods, wood piles, gardens, debris in your yard, a shed or a stone wall. I love those places. Also think of places where mice are. They like the same places. Leaf litter, they want that moisture, that humidity. So they're going to be down under the leaf litter. They're going to be closer to the earth. And also thinking about their hosts. So they need these small mammals like mice to attach to for blood meals, and then deer later on, and everybody in between sometimes. So then here's just a little schematic about, okay, what can we do if you have a yard like this? This is something that you can think about, like pulling away the garden, the play structure, or whatever it is, from that border area, because that's where the ticks are especially going to be. You can use things like cedar chips. They don't like cedar, so that can be helpful to create some perimeters. And then let's talk about hosts. So we've got our white-tailed deer. So 90% of adult deer ticks feed on deer. And so the interesting note is that these deer don't carry Lyme, and they don't give Lyme to the ticks, but they actually provide a really important, they serve an important role, because when an adult female tick needs that blood meal, it's typically on this deer, and then they they lay their eggs for the next generation. So this is kind of an important ecological note. One quick idea about this, there's lots of research on this 4-poster tick control deer feeder. So what we've got is some bait, and we have these rollers that have permethrin on them, and permethrin kills ticks. So the deer puts their head in there and they get some permethrin treatment, which has actually been quite effective. So just a note on permethrin, because we're going to talk about it a few times here. It's a pyrethrum, which is a constituent of the chrysanthemum flower. So, sometimes we say it's sort of natural, but it is synthetic, and it does have some downsides. So it's been used for over 2,000 years to repel insects and arachnids like ticks, which is pretty interesting. But now in 1973, we have this man-made created pyrethroid. And so with that, it's super potent and able to repel ticks, but it's also toxic when wet to humans and pets. So be careful if you're utilizing it to treat clothing or shoes. Once it's dried, it's safe for us to touch and pets to be near. And then other things environmentally just to think about, right? So if it's being used on the grass or, industrial farms and things like this, then, it is very toxic to freshwater, aquatic organisms, and bees and beneficial insects. And there is some toxicity to birds. So there are some alternatives and some thoughts on how to use this if you'd like to. So we'll come back to that. Our next host is the white-footed mouse. So kind of earlier in the life stage of the tick, we've got the larvae, and 75 to 95% of these black-legged deer tick larvae are going to get Lyme from these mice. So the Borrelia will be passed from the mouse to the tick at this stage. And so later on, they can pass it to someone else. So this is a really great way to think about intervening, right? So if we address these mice with the larvae on them, this can really, prevent a lot of ticks with Lyme out there and other diseases. So one way in doing that is creating some tick tubes. You can make your own. I have a little video out there. Project Lyme, another awesome organization that tells you how to make tick tubes. You can also buy them if you'd like to. And so the idea is you're treating cotton balls, or you can save lint from your dryer, and you're gonna safely, go outside, spray that down with permethrin, let it dry, and then save some paper towel tool. Oh my goodness, it's getting late. Paper towel tubes or toilet tissue tubes. I also have people that like have quite an operation. They use PVC that they just refill. That makes sense. Something like that. And you're going to stuff the materials in there and put them out in mouse habitat, which we talked about is very similar to tick habitat. And so what will happen is the mice will be very happy to bring that material back to their nests. And then it will kill the ticks on them and their family members. So this has a huge impact. So over an 8-year period, there was a 93.6 reduction in exposure for humans with tick bites in New York is where they did that study. And there are other studies too. So it's pretty amazing. My patients, I've done it before. I don't need to do it now, but patients, like I'll tell them about it, and they'll compare before the tick tubes to post tick tubes, and they'll say, they'll come back in months later and say, wow, yeah, I'm definitely seeing less ticks. So highly recommend it. Works very well. All right, so now we're going to move into the landscape, and we see our little mouse there and our deer. So they're there too. So again, to start with like the industry standard, treating the landscape for ticks would be something like bifenthrin. And this is a pyrethrum-like permethrin made in the 80s. So it's synthetic, supercharged. It kills ticks by paralyzing them. But we have those environmental concerns. So there are alternatives to this. It works very well, but there are also alternatives. So there's a lot, and recently, like in the last 4 years, it was really great to do some more research recently. As I have a Preventing Lyme and Tick-Borne Disease Globally online course that's coming out this spring. And so I had to dig into the research again, and I'm really excited to see that there are a lot more studies on essential oils as options. Because the thing that I was also noticing with the few that were out there is that the methodology of studying this is just all over the place. So, I think maybe that could be why sometimes it gets dismissed, but also it's hard to compare study to study because of concentration and what part of the plant was used and which essential oil or other compound. And so anyway, I think maybe we're getting there, and we have some nice results. But just to say, essential oils, if you don't know, are these organic volatile compounds produced by aromatic plants. And they do this for their own health, right? So they attract pollinators and seed dispersers like bees and naturally for the plant world, for nature, to function and thrive. And it also, these essential oils in these plants protects the plant from bacteria and other microbes and predators. So yes, we can also utilize these essential oils for tick repellents and treatment of the landscape. So we've got eco-exempt IC2. So this was pretty awesome. This is an older study. So it suppressed 100% of black-legged ticks for 2 weeks after application. And then it suppressed 63% of the larvae, just the tiniest ones, for 5 weeks after the spray, and 93% of the adults for 14 weeks after the spray. The thing about this is it's hard to find nowadays, and the one that it was replaced by is called Essentria IC3, and it seems like the efficacy of this is less, which is sad. But if, I've had patients use this, and the idea, the question is like how, so therefore how often should we apply this, right? So I have a lot of people that do it 3 times a year, and it definitely, you know, the knockdown will be very effective. And then it's just a matter of how much, you know, can we trust this to keep the ticks completely out? But I always think doing multiple things, right? I think taking some of the ideas today and hopefully over time implementing a few of them, you know, is going to really make it a well-rounded tick control sort of approach. But anyhow, I know that some local pest control companies will carry something like this. So you could definitely ask. So instead of having the bifenthrin, right, one of those permethrin type pyrethroids, which you could choose to do, but you could also try something more natural, which yes, you should probably apply more often, but it's definitely out there. So just to know about that. And then Nucotone, I'm very excited for this to finally come out someday. I don't know when, because I was researching it back in 2000, or reading about it back in 2017, you know, and here we are, 2024, and it is not commercially available. But I am thinking this is going to be really life-changing. So, so what we're doing landscape, right? So right now, what we're, because it's going to come up later with tick bite control. So with the landscape, you can actually use this hopefully someday. And it had this suppression of 100% of nymphs. They also studied dog ticks, or sorry, Lone Star ticks. So we've got the black-legged and Lone Star tick there for 2 days. And then more than 65% up to 21 days. And then they also studied carvacrol, which is in certain, it's an essential oil like oregano and black cumin. And so that one also was pretty promising. But it's even more promising for repellent. So we'll come to that later. So where this is from, I didn't mention that, is from grapefruit and the yellow cedar. So it's just a particular essential oil from those plants. So here we are in tick bite prevention. So who's at risk? Farmers, construction workers, foresters, veterinarians, anyone walking across the grass in a tick endemic area, right? All right, so back to permethrin. This is pretty amazing. And I hear back from my patients all the time. I do this myself too. So just treating your socks and shoes with permethrin will decrease the chances of a tick bite by 73 times. So that's pretty huge. So what I do is I put on my calendar every 6 weeks, bring the boots and sneakers and shoes outside, spray them all down, wear gloves, let it dry. Then you can bring it back inside. And it's great. It's just a great barrier if you're thinking about, you know, just your basic walking outside, you know, going on a hike, that you're not like going out into the grass and, you know, rolling around the ground. You know, this is a great way to create that barrier between you and the grass or the leaf litter where the ticks are going to be. So highly recommend that. If you want to get your clothing treated, you could certainly do it yourself also, but then every 6 weeks gets to be a bit much and you've got to like really soak it and then hang it up, which you could do. You could also choose to check out insectshield.com. They're awesome. And you actually can send your clothes to them. They will treat it and it will last 70 washes in the washing machine. So that's a long time, right? So there's a study in North Carolina, and wearing this type of commercially done treatment, permethrin treatment of the clothes, they had a 99% decrease in the rate of tick bites during working hours for those people. So if you're somebody who is a forester, a landscaper, et cetera, and you're really out there all the time, or even if you're a gardener who's out there few times a week, or whatever it is you may like to do, you know, you may want to have like an outfit or a few outfits. And then, you know, those are your permethrin clothes. The same what I did, I get my socks from them. So I know they're the permethrin socks because they look different. So that's a good, very good tool. And then as an alternative to things like DEET works for sure. But as an alternative to that or Picardin, you know, again, I go through all of this in the book and the course, but for time today, I want to get to your questions eventually. So, so one highlight would be cedarwood oil. It has 100% kill rate, but that's when you're literally spraying ticks. So hopefully, but what we see is it only lasts 1 to 2 hours. So it works very, very well, just as well as DEET. And this actually just came out a couple of years ago. They compared it to DEET, and it does work just as well, but for just 1 to 2 hours. So it's hard to remember, right? So a combination of some of these pieces, right? If you're wearing shorts and you really want to be wearing sandals and shorts and not, you know, permethrin socks and shoes, then get your cedarwood oil out and spray your legs down every 1 to 2 hours wherever you are. So yeah, so that's at Cedar Side is the company I like. And Nude Ketone, we have, yeah, so this is the study showing 100% repellents for 3 days. So that's when it's used on the person to repel both black-legged and Lone Star ticks. And so this company, Evolva, I hope, comes out with this product soon. I don't know when. So it's called Nootka Shield. We are all ready, and I hope it's going to be amazing. So now we've prevented ticks in the landscape, preventing ticks from getting on you. But next, of course, the good old tick check. Sure, you all do this already. Just don't forget those hard to reach places. I see a lot of ticks, and the other day was a belly button. You know, a lot of ticks with kids are like in behind the ears and the hair. So they love moist areas. So making sure you're checking those moist areas. And then putting your clothes after your tick check when you come in from outdoors, right? You can put your clothes right in the dryer. So 6 for ticks. You can kill ticks within 6 minutes on high. You've got to use high heat, and you have to skip the washer. So if you go to the washer first, it's probably not going to kill any ticks. And then you have ticks in your washing machine. But I know you have dirty clothes, so who wants to skip the washer? Anyway, if you can, I'd skip the washer, go right to the dryer. Then you can go back to the washer if you want. But yeah, then you have to put it on for an hour, basically, in the dryer if you do go to the washer first with these clothes, if there are ticks on them. All right, let's move on to what to do after a tick bite. You've done all this, so you're not going to find a tick anyway, but just in case. And here I will mention, because it's important, there are 2 standards of care, as you probably know, the IDSA or CDC, and then we have ILADS, International Lyme and Associated Diseases Society, which is a medical society that looks at other literature out there. There's lots of research out there showing things like we need to treat Lyme different ways. There are better tests, things like this. And so in here, I guess the point is right now, in here, we'll mention that for a little bit, but in other places I go into it in more detail. So 6 steps after a tick bite. So first, of course, we want to remove a tick as soon as you can. I like this Oton tick twister. It's my favorite. You know, I was using tweezers at first, and I'm just like macerating ticks. The mouth parts are staying in the person, and to me, that's just a nightmare. And there are some things that look like this, but this company I do see is particular. Maybe there are other good ones too, but I used other ones that look like this, these twisters, and the tick just went right through it. So this one, it grasps it and you twist it up and pull it out. So then you could identify it. You can put it in a little baggie and save it. Then we're going to apply first aid. So we've got some andrographis tincture. So this is an herb that I use in treating. You can use it orally to treat yourself from Lyme, along with many other things, but we can put it on the tick bite. So what I recommend is doing that. If you don't have it, you can certainly use something like rubbing alcohol or peroxide, but some kind of antiseptic on the bite. And then I do see that people tend to say that they're less itchy or irritated after. So I feel like it helps the healing process. But the idea, unfortunately, is that when a tick attaches, it can release feces onto the skin. And then in the feces, there can be pathogens, that, tick-borne disease pathogens. So if you, if someone's like, oh, there's my tick mite, I'm touching it, oh, it's itchy, you're moving that into the wound that can cause, a further infection. Lovely picture, I know, I'm sorry. So if you want to put andrographis or an antiseptic on it, that would be great. And then some homeopathic first aid. So Leadum 30C. I don't know if you know homeopathics. It's natural therapy. That's these little pellets you put under your tongue, 3 pellets under your tongue 3 times a day for 3 days. Now, this is not to replace treatment for Lyme disease, so please don't misunderstand that. But this is great to do to have at home in case of a tick bite, because it can, before even Lyme can happen, right? So right away, you can help your immune system work a little better with these homeopathics. And you can take them along with antibiotics. That is fine, or herbal medicine and all of that. Apis, if you have more of like a hot or reddish, angry looking sort of bullseye rash even. But again, we want to have proper treatment in addition to the apis. And you can take them together. Okay, then we can test the tick. So we want to find out what type of tick is it and what pathogens is it carrying. Maybe none. That's always exciting to find out that there are no pathogens in the tick. But if there are, it's nice to know which ones, because then, like we saw earlier, then you know which pathogen it is, which symptoms to look out for, what to report to your doctor, and how to treat it if there are symptoms. So you can go to tickreport.com or technology. Tick Report is in Massachusetts. They're, I think, probably the most ahead at this point. So I trust them a lot. And you go online and fill out your forms, you mail the tick in, and you get an email back with the results. I don't know if you have anything local. You might have somebody local that does this, but yeah, it's a great service. Sometimes there's like a free service, but they just tell you what type of tick it is. So these people are really looking at with pathogens, and they have great quantitative PCR technology. All right, so here's our possible ILADS option. So step 4, if you want, you could think about doing pharmaceutical treatment after a tick bite compared to the one-time dose of doxycycline, which would be the CDC recommendation. We have the ILADS recommendation of at least 20 days of doxycycline after a tick bite, especially within 48 hours after the bite. And then in addition to that, I also, instead of, I like to do an herbal formula after a tick bite when there are no symptoms. 30 days of something called deer tick bite formula. So I created this based on Stephen Buhner's work. I don't know if you've heard of him, Healing Lyme, awesome book, amazing person. A lot of great information in there. So the great thing about herbs, one of the many things about it is, they do many different things, right? They have different constituents within them. And so we're not just trying to kill something, although that's part of the point. We're also helping your immune system work better to function in the face of tick-borne disease. And the contents of the deer tick bite formula get to both the free form, that spirochete form of Borrelia Lyme, as well as the round form, because that little spiral guy balls up into a cyst form or round form, and the herbs actually get to that, which is important. And the idea is it targets all of the pathogens that are that can be anyway, in the deer tick or the black-legged tick. And then it helps, protect your joints, which can be helpful if there's Lyme disease, and your neurological system, your eyes, your liver, etc. So this is the idea more of the antimicrobial piece of the target pathogens and the botanicals. So we've got Eukarya tomentosa, which is cat's claw, Polygonum cuspidatum, which is Japanese knotweed, Cryptolepis, and Houtunia. So those are what is in the deer tick bite formula. And actually, so I created formulas per tick. So if this is, of course, the #1 public enemy out there, you know, the #1 tick that we're seeing. But there are other formulas appropriate to whichever tick it was. So the way you take this would be 1 teaspoon in water 3 times a day on an empty stomach for 30 days after a tick bite. And then, of course, you're going to watch and wait for symptoms. So that's very important too. And if there were symptoms, then we move from a tick bite without symptoms to symptoms, which means there's probably a disease process happening, right? So if there's a fever, this is telling us there's a disease process, and that's where we can add pharmaceuticals and make sure we're treating long enough, you know, past that 30 days. I always recommend treating 2 months past the resolution of symptoms. Step 6 would be get tested, maybe. So maybe depending on, you know, what has come up, if there are symptoms, and the timing, because it's a little complicated. You need to wait 4 weeks after a bite for the Lyme test to be accurate. And then even that accuracy is in question depending on what test you have, which I'm sure some of you know. So that's why the maybe, you know, maybe if there are symptoms, we actually just want to treat, right? Because that is actually the most important thing. But of course, depending, like anaplasma, anaplasma is kind of horrible to experience acutely. It's usually worst headache of your life, high fever. Most people go to the ER, but it's easily tested for. The regular tests are accurate, and doxycycline treats it. And that's typically all you need for 2 weeks. So that test, for instance, if you had a black-legged tick bite, might be appropriate and helpful. All right, so the tick preparedness kit. So I actually put together all the contents that we just talked about. In case anybody's interested, you can get one if you so desired. You could probably also piecemeal it together and create your own, but it has the homeopathics, a little Ziploc bag, the Otom tick twister, the andrographis tincture for on top of the tick bite, and then a starter of the deer tick bite formula. All right, we're almost there. Thank you for bearing with me. So we're going to just talk about a template for acute Lyme treatment. So for today, we're just talking about Lyme. And here's just a note, of course, if you're experiencing symptoms, please seek medical advice, hopefully from a Lyme literate practitioner. And here is a list of places that you can find somebody. So the International Lyme and Associated Diseases Society has a Find a Practitioner tool, LymeDisease.org and the Global Lyme Alliance. And then Terry asked me to mention, I do see people from outside of my states that I'm licensed in. I'll consult with them. So I have a license in Vermont, New Hampshire, and Massachusetts. And so I can, you know, have my full scope of practice working with people there. But in Illinois or outside of Illinois, in other places, I do consult with people. So a lot of times they might have a practitioner on board or partially willing. And even if not, some people just want another opinion. And I work a lot with natural therapies using botanical medicine in addition to pharmaceuticals, but I wouldn't be able to prescribe, for instance, pharmaceuticals, but basically we can talk about everything and do natural therapies. So here we have the Lyme disease treatment. So again, there are the 2 standards of care, and the ILADS guidelines says that evidence does indicate that 20 days of a prophylactic antibiotic treatment may be effective for preventing Lyme after a tick bite, and that people might actually need 4 to 6 weeks of antibiotics after a tick bite and with early Lyme. But ultimately, this is a clinical diagnosis, and that there can be chronic Lyme infections, and those people deserve individualized treatment, plans, right? We might have co-infections, we might have other things going on, and it's really important to look at each person and what they're dealing with and their clinical picture, maybe do some labs, figure out what's going on and treat them appropriately. And here we have our Borrelia burgdorferi, our little spirochete, and then it can change forms into that cyst form or the brown form in the middle. And then on the other side, we have the biofilm. So this is to say, it's complicated, right? So we need to think about all these things when we're treating. We want to make sure to address all the ways that Lyme exists and hide. So this is a template. You know, again, this is acute Lyme. So I think templates are very helpful for acute disease. Once we get into chronic illness, it might look like this, but it could look so many different ways because thankfully we have many different tools. You know, we have things like dapsone and disulfiram now if we need them. And we also have a whole host of amazing natural therapies, essential oils that are safe to take internally for us, as well as other herbs and natural therapies. So many options, but right after a tick bite, somebody gets an erythema migrans, Lyme rash, or fever, you know, clear, new acute Lyme, this is going to be a very effective way to start. And I see people do so well, and they resolve symptoms, and they move on with their lives, and it's wonderful when we treat Lyme early. I'm very passionate about working with those people so that they don't have to deal with chronic illness. So, for instance, doxycycline, but of course there are alternatives. We could use cefuroxime or azithromycin. Nystatin is an antifungal I like to use. I do tend to recommend that the antibiotics in acute Lyme. So I don't know, you know, it's how you all feel about that. But I tend to see that they are very effective in the beginning, right? And it's more chronic illness, right? Things can be different, and they can still be effective perhaps, but I think later on is when we really need all the other tools. And I do see that using the pharmaceuticals early on for the first month, and then after the first month, I'll change to a natural protocol. We'll usually, you know, do that 2 months or 2 months and a week or whatever it is, because usually, you know, symptoms resolve in a few days. It's pretty amazing if you really get it early. So anyway, back to the plan. So we probably are going to use antibiotics, nystatin, and then one option would be the Lyme formula. So this has the cat's claw, the Chinese cat's claw is the second name. The third name is Japanese knotweed and andrographis. So that those, again, and herbs work in so many different ways, helping your immune system work better also in the face of Lyme. Or an alternative would be something like grapefruit seed extract, which gets to the round form. So paired with an antibiotic, sometimes I'll do that. And then if we wanted to, if somebody had a lot of, you know, if had Bell's palsy or some, you know, neurological symptoms right in the beginning, we may want to use a little supportive formula that has more knotweed, curaria, which is also called kudzu, salvia, which is red sage, and baikal skullcap. And that can just be a little more of a boost in the way of neurological support and immune support that some people need, you know, and this I use a lot, you know, on chronic Lyme too. All right, the next thing is something for biofilm. So serrapeptase is an anti-biofilm agent. There are other options as well, but we want to break through those biofilms. So a bunch of those spirochetes can get together, create this shell around themselves, hang out that way. Your doxy can come and go, there they are. We want to break through that fibrin layer with something like serrapeptase, which is an enzyme, and then expose those spirochetes to the rest of the treatment. And then I'll always add probiotics if we are using antibiotics, just 2 hours away from antibiotics. So yeah, so that's a template for like where to start. You could always bring something like that to a provider, ask them if they would be amenable to it. And here's just some information. So if you're interested in, I have a tick bite prevention handout, which is honestly like a major summary, very concise summary of what we just talked about regarding the tick bite prevention part and what to do if you get a tick bite. So if you were interested in that, you could go to my website and sign up. You'll get an email with that handout. And then there are other things you can find out there if you were interested. And yeah, I'm excited for this course to come out soon. So if that's of interest, I just want to spread the word. I hope that you gleaned something from today and you can pass it on and hopefully enjoy the outdoors, right? With some of this information and prevent tick bites. Thanks for
Great.
having
Well,
me.
thank you, Dr. Chesney. That was awesome. I think no matter how far any of us are in our journey, that we learn something from it, because we've all had such different experiences, being diagnosed in different ways, and live in different environments too. So I think all of that was helpful to all of us. I know several people probably have questions that they want to ask you before we let you go. So if anybody wants to chime in, feel free.
Yeah, first of all, thank you so much. This was an awesome presentation. I really got a lot out of it. On the pyrethrum, one, I know it's really bad for cats, can be fatal to cats. But my question is, you said once it's dry, it's safe. But what if you're in the rain? Does it reactivate if the pyrethrum gets wet again? Is it a
Right,
problem?
good question. So it's not a problem in the rain. So once it's dried into a material, it binds very tightly to the fiber. So it's only with a lot of agitation, like in the washing machine, you'll release a little bit. But yeah, rain or going in water, just, yeah, that's fine. Submerging, that's okay.
All right, thank you.
I had a question about, you said there was a 30-day herbal treatment that you use sometimes too. Is there a brand name for that you use a
So I
particular
work with
one?
Lyme Core. Yeah.
Okay.
Yeah, I put it together with Lyme Core. I mean, you can like search for each. It's hard to find Cryptolepis though, but you could search for each ingredient and make it up yourself. I mean, anyone
Okay.
could. If
But
you
they
want it
sell
made up
one, right?
already.
Lyme Core does.
Yes. Yeah, I work with them. Lymecore.com. Yep. And they have the tick kits too. So they have the deer tick bite formula and the tick preparedness kits, which have a little guy of the deer tick bite.
Awesome. And I know you mentioned at the beginning that you also do acupuncture. Can you tell a little bit about the benefits of that for Lyme?
Oh, sure. Yeah. So of course it's not antimicrobial in the same sense, right? Because so much of the focus is usually, antibiotics, herbal antibiotics, whatever. But yeah, I see that people can really benefit from it in a lot of ways. So it depends on what symptoms they're having as well. So we can target, specific symptoms. And if it's more, joint pain, we can create certain protocol around that, using certain needles that are going to help with whatever the joints are that are painful. But also thinking about things like the immune system and creating. So in Chinese medicine, we talk a lot about qi, and that's like life force. So qi can get stuck, to go down a rabbit hole a little bit, but and if it gets stuck in certain places, and sometimes this makes sense intuitively for people, but it can create pain basically, right? Or if we think of qi being stuck, if our life force is stuck, then we're not going to feel well. We want to move that along. We want to tonify it or adjust it in these different ways that you can, or help it in certain ways, so that it brings more vitality, right? So, so we can also think about it more theoretically like that, but also we can think practically about, oh, you have, nerve pains over here, we're going to help with that, or whatever the symptom might be. Sleep, fatigue, a lot of the big ones that people struggle with. So, yeah, I love it in conjunction, with everything else that we might do.
Good. Thank you. All right. Well, Dr. Chesney, I think you're finished for the night. Thank you very much.
Right.
We appreciate it.
You're welcome. Well, thanks so much for having me. I hope it made a difference, and I'm so glad you're out there doing this important work. I hope you have a wonderful meeting.